Here's what we know. Kennedy has been diagnosed with a malignant glioma in the left parietal lobe. That's what caused him to have those 2 seizures this past weekend at his home in Hyannis. His doctor says Kennedy, though, remains in good overall condition. Doctors also say they'll be doing further testing.
Now we want to bring in our Dr. Malika Marshall. Exactly what is malignant glioma?
All right, here we go. A malignant glioma is the most common type of primary brain tumor, meaning a tumor that begins in the brain and hasn't spread from some other part of the body. Now, his tumor is in the parietal lobe, which is involved with sensation and language. Malignant gliomas account for half of the more than 18,000 primary malignant brain tumors diagnosed each year in the U.S. And because it's malignant or cancerous, it can grow quickly, though it usually doesn't spread beyond the brain. It usually just spreads deep into the brain tissue.
So how do they treat a condition like this that's facing the senator?
Well, usually it's a combination of radiation, chemotherapy, and or surgery. His doctors will likely be doing a series of tests, such as specialized MRIs, EEGs, and PET scans, to map out exactly where this tumor is and to help them determine the best course of treatment. Now, surgery is sometimes an option, depending on the size and location of the tumor. But what we're hearing from his doctors is that they will begin with radiation and chemotherapy at this point. No plans for surgery as far as we know.
It sounds serious. What is the prognosis?
I can't lie. It's not a good one. And, I mean, we don't know exactly what type of malignant glioma he has. There are several different types, and some have a more favorable prognosis than others. The most common type, unfortunately, is very aggressive. Worst case scenario, survival can be as little as 6 to 12 months, but it can be up to 3 to 5 years or so, especially with aggressive treatment, and we expect Kennedy to get the best treatment there is.
Okay, let's be as optimistic as we can. What are the chances this type of tumor can be treated successfully?
Well, successfully, there probably is little chance for a cure. I mean, with malignant glioma, it's very difficult to remove all the cells completely because it grows so quickly and the tumor often comes back. But again, with aggressive therapy, doctors can add months and perhaps years to a patient's life, and that will be the goal from here on out. So we will anxiously await the exact diagnosis and the pathology report and figure out exactly how the doctors are going to treat him.
All right, thanks for helping us understand this a little better.
My pleasure.